When you go to the hospital and have to stay overnight, you just assume you've been admitted.
But depending on your insurance, that might not be the case. Connie Thompson explains a healthcare technicality that could leave you or a family member on the hook for thousands of dollars.
We are talking thousands, and we're talking an effect on possibly millions of families with loved ones covered by Medicare. You're in the hospital, then you transfer to a nursing facility for rehab. But you were never really admitted to the hospital. You were an outpatient under observation, which means you paid for that rehab.
What's happening to Lisa Collins?
I'm thinking the worst.
And her 93-year-old mother.
And I was just standing here like this.
Is being played out in families across the country. First, the emergency.
God bless me. So
In Lily Collins' case, a fall.
I don't know how I felt. I just know I fell.
A call for the ambulance.
I was home alone.
A trip to the ER. Lily went to Swedish Hospital's Cherry Hill location.
I don't remember going to the emergency now.
She was transferred to the main medical center.
Took me into the room.
Nothing broken, but she was very weak.
They did an x-ray. They did the x-ray in the bed.
The hospital kept her overnight.
She was not able to stand up by herself.
And she couldn't be home alone. Seeing no other option, Lisa looked for a nursing home for rehab, while doctors kept watch over her mom. She searched for more than a week.
Nobody would really want to take her.
Here's where it gets tricky. Lily's on Medicare, and with Medicare, you have to be admitted to the hospital at least 3 days before you're covered for nursing home rehab, which Lily needed. But Lily was never technically admitted to the hospital. She was on observation as an outpatient.
She was as observation and not admitted because they said that they didn't have, she didn't meet the medical criteria.
Hospitals must provide quality care, but also follow Medicare's criteria for billing.
This is a recent federal government review of hospitals from across the country. It reveals that Lily is part of a trend. Fewer people classified as inpatients, many elderly classified as outpatients, who must often pay more if they need additional care.
If they would have admitted her, she would have been able to go to a rehab center, which is what she really needed. And then Medicare and her secondary insurance would have picked it up.
Did you catch that? If you're a 3-day inpatient, Medicare picks up your rehab nursing home costs. But if you're classified as an observation outpatient, the bill's on you. That's thousands out of your pocket.
I think for the individuals who are affected, it really can be a crisis.
Patient advocates warn families everywhere risk huge nursing home rehab bills they don't expect.
Families are paying huge amounts of money, often up front. Nursing homes will say they want $10,000 up front for the first month's admission.
Call it an unintended consequence of government cost cutting.
If a provider charges Medicare or Medicaid inappropriately, then Medicare or Medicaid doesn't pay at all. So there's a big penalty.
If the hospital bills Medicare for inpatient treatment and auditors later determine you really got outpatient care, which is less expensive, the hospital must give back all the money Medicare paid for your bill. It's really complicated.
So hospitals have to follow the rules.
It's all the same room. It's just the level of care that you're getting. So I don't know.
With her mom's hospital charges growing, Lisa Collins finally followed her instincts and skipped the nursing home plan.
I said, I'm taking my mom home.
Friends and family now help Lily recover at home.
She wants to try to do it by herself.
And Lisa waits to see what portion of that outpatient observation hospital bill Medicare will pay.
I'm thinking the worst. I'm really thinking the worst. I'm afraid that my mom's going to have a huge bill that she can't afford.
There we go.
Swedish Hospital tells me it will not be reimbursed by Medicare for the many of the days that Lily Collins spent in observation. Even though Lily could have been discharged after one night, Swedish says it knowingly provided continued support while her daughter looked for a nursing home. Swedish told Lisa about the observation status on the second day. Now, to make sure everyone knows about this, a new law this year makes hospitals tell you verbally and in writing within 36 hours of putting you or a loved one on observation status.
Well, now you have all of our attention. So what can
Good.
families do to be more prepared for something
There
like
is the
this?
law, but I say don't wait for that disclosure. The main thing is to, as soon as you get checked into the hospital, ask, am I a patient or observation? How long are you keeping me? Will I need extended rehab care after I'm discharged? And always, always have a backup plan in case rehab care is on your dime. Many families are having to sell insurance policies and do all kinds of things.
Well, it's crazy because if you have to go to the hospital, you just think about the care and the
Right.
concern.
Absolutely.
You're not
Right.
thinking about all this other stuff.
Yeah, so this is a heads up for all of us because if you're not on Medicare, you know someone who is.
Thank you very much, Connie.
Great information.